This is an AC joint reconstruction post-operative protocol. The goals and expectations following surgery is that the shoulder will become stiff in the weeks following surgery. Allowing the shoulder to stiffen after surgery facilitates healing of the repair. It is expected and necessary following the repair, and it will resolve with the help of physical therapy. On the day of surgery, use ice for the cold therapy unit over the shoulder for 15 minutes every 1 to 2 hours to decrease pain and inflammation. Begin taking pain medication as prescribed as soon as you have pain. Do not wait until you are in severe pain before taking the medication. We would expect that you should be able to stop taking the medication within 2 to 3 weeks after the surgery. Begin eating with liquids and light foods. Progress slowly over the following 24 hours following surgery. Keep the dressings on the surgical site until your first post-operative visit. Usually this is 7 to 10 days after surgery. You may bathe or shower, but keep the dressings dry and the bandages on. No swimming until instructed by your surgeon. Continue to use the sling until your first post-operative visit. You should wear the sling for 6 weeks following surgery. You should wear it to sleep. Do not drive until instructed to do so. You will begin formal physical therapy at 6 weeks following surgery. Contact a local physical therapy provider to begin therapy. We will give you a list of facilities as well as a prescription prior to surgery so you can schedule in advance. It is normal to experience swelling and bruising in the arm, elbow, and wrist. You may bend the elbow and wrist, and this will decrease the amount of swelling that you have in the arm. It is very helpful to keep the arm elevated on 2 to 3 pillows so that the arm is above the level of the heart while lying down. There are 4 main phases of rehabilitation in addition to the early postoperative phase. In the early postoperative phase, from 0 to 2 weeks, the goal is to control pain and swelling. You should be icing and resting the affected shoulder, doing pendulum exercises, straightening and bending the elbow, wrist, and fingers several times a day, doing shoulder shrugs, scapula squeezes, ball squeezes, and passive range of motion. You must wear the sling at all times and avoid lifting objects with the injured arm. Pendulum exercises, as pictured here, involve bending at the waist and allowing your surgical arm to hang freely while stabilizing yourself with the other arm. Relax the arm completely and swing the arm back and forth in a circular pattern and repeat this 10 times. Shoulder shrugs, as demonstrated in this picture, involve shrugging your shoulder as far up as they can go, holding them there for 5 to 10 seconds, and then lowering them down and repeating this. Scapula squeezes, as pictured here, involve flexing the muscles between your shoulder blades to try and pull your shoulder blades together in the back. Hold your muscles in that position for 5 to 10 seconds and repeat this 10 times. Ball squeezes are self-explanatory. Elbow range of motion involves removing the arm strap of the sling, straightening and bending your elbow as far as you can tolerate. Do this 10 times slowly. Forearm and wrist motion involves turning your palm up and then palm down. Do this 10 times. Shoulder range of motion is passive. You want to gently use your non-operative arm to lift up your surgical arm. Do not lift it higher than your shoulder level or 90 degrees. This is considered passive motion when you or someone else lifts the arm. In phase 1 from week 2 to 6, the goal is healing of the repair. You can do pendulums, scapula stabilizations, and isometric bicep and tricep exercises. You must wear the sling at all times and avoid lifting objects with the injured arm. In phase 2, from 6 to 12 weeks, the goal is to regain full range of motion and begin strengthening exercises. You can discontinue the sling at week 6, begin formal physical therapy, where they will participate you in passive and active range of motion, full range of motion, shoulder shrugs, a rotator cuff program, scapula stabilization, as well as biceps and triceps strengthening. You may not do any contact sports. In phase 3, from week 12 to 18, the goal is to return to full activities. Exercises will be focused on active range of motion and shoulder strengthening. You still must not play any contact sports. In phase 4, greater than 18 weeks, you will advance to full activities. Thank you.